Hi, this is Kimberly. Please enjoy our podcast, but remember our doctors are only here to educate, not diagnose. If you have any questions or need any further information, please email me. My email address is kim@mfwellness.org.
Hello everyone, Dr. Matt, Dr. Brad here, and Kim. Dr. Josh is consulting with a patient right now, so he'll be in shortly, but we wanted to get the ball rolling, so to speak. So we're going to be covering the pandemic and the effects it has had on ergonomics. Now, we've kind of talked about this before, but the pandemic is still happening.
Yeah. We're almost 2 years in here.
Yeah.
We're still dealing with effects. We're seeing patients just recently, within the last 2 months, 3 months, and their lower necks are just destroyed.
Yeah, because they thought, and we thought that it'd be more of a 3 to 4 month kind of thing, but it's more been like a year and a half and still working from home. And people don't want to go back to the office because they've been enjoying working from home so much, but they haven't kind of changed their office or changed how they're doing work.
I don't know what's going on, but we need to talk again about proper stretching, taking breaks, proper setup, especially if you're working at home. Hopefully at this point, if you've been working for almost 2 years at home, that you've spent the time to work on the ergonomics. But we're going to talk about that once again, just to make sure we're on the right track here.
So what kind of things have you guys seen in the office recently?
Disc issues in the lower part of the neck that we hadn't seen to this degree before. People are coming in as new patients, and
17, 18, 19 years we've been in practice, and we haven't seen the degree of disc herniation like Dr. Brad was saying, or just forward head posture that's been going on. People complaining about feeling like their head's going to fall off, feeling like their shoulders are up past their ears. Just the kind of things that patients complain about or notice while they're trying to live their lives.
Yeah, and I would say along with that, going along those lines, we've had to refer more people out for MRI than I can remember in just this short period of time. And we just feel like it all traces back to people changing their daily lives. I would say we've sent out 5 people in the last little over a month.
Yeah, and the reason why we're doing that is because there's been no progress with the case once the diagnosis is made. And so our job as chiropractors, myself, Dr. Brad, Dr. Danielle, Dr. Amanda, and Dr. Josh, our job is to figure out where the subluxations are, correct them, put the motion back into your spine, and then go from there. Along with the proper diagnosis, the implement of the plan is essential. And if that plan isn't going according to how we think it's going to, we need to refer you out.
And I think we're so, over the years, like you said, 17, 18, 19 years, we're so used to that plan working just great.
Every time.
Then, now lately, it's like, what is going on? But through our consultation and history, we find out that a lot of it does have to do with improper ergonomics and just people not doing things the way they used to. And
I wonder how many people are working from their couches still.
Yeah. So my wife now is working from home full time. Oh. And before, when she was working from home or when she had to stay home because of whether close contact or exposure or whatever, it was at our dining room. And that's not necessarily ergonomically kosher because, you're only going for 2 weeks, you're only going for 3 weeks, and then you're going back to work and no big deal. And that wasn't necessarily the best setup. Now she's moved into an office space inside the house. We set up her desk. We set up the proper ergonomics. So yeah, I'm sure that other people are exactly like my wife, and they're trying to just get back to surviving working from home.
This is probably a good time for me to kind of talk about some specifics as far as ergonomics. I know I've done videos in the past. When COVID started, I've done videos. We've talked about in the past, we always have handouts around it's better to kind of visualize this, but I'll try to kind of walk you through it verbally. The first thing is you really need, if you're working from home, you really need to have an actual office chair. There is a reason why those are developed. If you're still using the couch, or even if you're using your kitchen table, usually that's not set up height-wise for you to be on a laptop or a computer. So first, that's the biggest thing. It's worth the investment in having a good office chair.
The other thing with that is that gaming chairs are really supportive of your neck and your arms and your low back. So like,
those are even better than computer chairs.
I know
aren't they?
several people
Yes.
who use the gaming chairs as opposed to just a basic.
yeah, that's
chair.
that's what Sarah uses for her office chair at home.
Yeah, that thing.
Is we have 2 purple gaming chairs.
That's the way to go.
Yeah, it's the only way to go.
So once you get the chair and you have a proper desk, that's what we approach first. You want it to be set up so where we have 90-degree angles at different spots. So thighs down to the lower legs, about a 90-degree angle, maybe a little bit greater. We also, at the elbow, want approximately a 90-degree angle. It could be a little more. It could be, I see some charts that say up to 120 degrees. But along with that, we want nice support for those arms as well. So for us, that's how we approach it first. And then we look at the monitor, because you can always put something under that monitor. A lot of monitors move up and down, but if you have to, you can always put something under the monitor to raise it up. Because what we want your eye level to be around the top 1/3 of that monitor. And then along with that, you don't necessarily have to measure this exactly, but we like that screen tilted to where the bottom part of the computer screen is about 10 to 20 degrees forward compared to the top of the screen. So we want a little tilt there. Helps with glare and things like that. Those are the big things. And then if you have a standing desk or a sit-to-stand desk, really most things stay the same other than that chair and that 90 degrees at the knee. We still want the arms and the supported and in 90 degrees, and we still want our eye level at the top portion of that screen as well.
What about people that have more than one computer screen, and how they're going, like 3 or 4 computer screens or 2 computer screens? How would you give recommendations on how they should set it up regarding looking forward? Because one's always going to be down to your left or down to your right, and you're kind of going back and forth. What do you think? What's the best way to handle that?
That is tougher. I've seen some people with at least 3 screens, and then I think it's okay to be able to turn your head, but if you know you're going to be looking at the one particular screen for a long period of time, don't keep your head turned that whole entire time.
Still. Okay.
Make sure you should have a swivel chair.
Right.
So if you know you're going to be focused on that one screen, don't have your head turned or cocked to one side for too long of a time. Actually swivel your whole body to face that way, and potentially slide your keyboard as well. I know that can be a little more involved, but you don't want to necessarily be facing this and then having your keyboard in the other direction. So I just would make sure, if you know you're going to be facing one of those for a longer period of time, make sure you shift things towards that particular computer.
Okay, so how would we best protect our wrist as we're typing and working at home, Dr. Brad?
First, I think having that proper setup that I was talking about with the height of the chair versus the height of the desk and having those 90-degree angles, that will help. But there's also keyboards that are developed to help with the wrist, and there's also keyboard pads that you can place in front of the keyboard, what we call them thenar pads, the base of our palms or our thumbs on that while we're typing. So there's tons of different options out there, especially if you're dealing with one particular issue or another, whether it's your wrist or your elbow or whatever's going on. But make sure you're talking to us about those things. We can most likely point you in the right direction when it comes to different setups at your desk.
Awesome. Okay, so we've kind of covered the ergonomic aspect and how to best protect your neck and your upper back and how to properly set up your home station. Now we're going to kind of go into the best exercises and what you can do for yourself. So one of the things that you can do is every 25 to 30 minutes, stand up, walk around for 15 seconds, 1 minute, and really try to approximate your head to the top of the ceiling or to the sky, whichever you can visualize the most. Because we're telling patients and people, you shouldn't just try to stand straight or rigid. We want you to stand tall, okay? As tall as you can, because when you do that, it actually brings your neck in line with your shoulders and it forces your fingertips down. Think about a person that is standing nice and tall, and their posture. They're going to be almost regal in aspects. So shoulders back, head up, chin tucked in. And then when we talk about the chin being tucked in, we talk about retractions or neck retractions. And those are exercises that are designed to strengthen and activate the deep neck flexors. So if you can visualize this, take your fingers, put them on your chin in an upward way. You're going to actually bring your chin in or tuck your chin into your neck. And you want to do that slowly. Now, if you have any questions regarding that, we can help you out, no problem. But that's really a really good way to strengthen and activate the deep neck flexors.
Yeah. We also have a good handout in the office that's basically just all office stretches.
Yeah.
So that's something we could pass along as well.
Another way to warm up and stretch out your neck is to actually position your hand on the side of your head, just one of your hands, and you're going to actually push your head into your hand just for about 15 seconds. And then you keep your hand still and you turn your head the opposite way. What that does is it helps stretch out, it activates the muscle and then stretches out the muscle afterwards.
What muscle?
The muscle in your neck, the trapezius, the
Please show me
levator.
because I'm interested.
So this guy right here.
Oh, really?
Mm-hmm. And then when you go to turn your head away, you can actually position your neck in a way that gets the best stretch. You really want to kind of figure out where you're feeling the pull the most, because that's where you'll get the most stretch, right? That's called PIR, or post-isometric release. And you can do that with both sides of your neck, and you should be doing that with both sides of your neck.
Like once an hour, is that what you said?
The stretch should be, once every hour, once every 2 hours.
But the breaks, and we're just talking about mini breaks,
Yeah.
are every 25 minutes or so. Just to kind of back away.
Isn't it good to reset your eyes too?
Yeah.
Like if you're working
look
on the
away,
computer?
if you have something on the wall, like 30 feet, 20 feet away,
Yeah.
Look at that for a little bit. And I know that sounds like quite a bit, but we're just talking about 1 minute to just rest your eyes, sit back, make sure you have that good posture, and get back at it.
You'll actually notice over a period of a couple of weeks that you'll be able to refocus and get to task a lot sooner and more efficiently as you start doing these exercises at your desk.
And that's the big thing. People think that they don't have time to take these little breaks, but what research has found is that when you do take these breaks, people are more productive throughout the entire day. So
and really we're cueing in on less injury as well, because less inflammation, less static, less stagnant positions, get your body up and moving again. And that's what bodies want, is motion.
With the blood flowing too.
Yeah. That's what joints need, is motion to stay healthy. Now, we've talked about the neck and a couple of different exercises for that. There's a couple more that we're going to do for the neck, and then we'll kind of hone in on the lower back as well. So 2 more exercises for the neck, or things that you can think about, is as you're standing tall or sitting tall, you can bring your shoulder blades or squeeze your shoulder blades together. And what that does is opens your chest cavity, right? Opens your chest up, and then brings your scaps or your shoulder blades together. Now, if you've ever sat at a desk, or if you have any injury in your upper back, you'll feel that burning right in the shoulder blade. You just want someone to dig in there and release that shoulder. So when you squeeze your shoulder blades together, you're actually activating and deactivating the front part of your chest. So that will decrease pain and increase awesomeness.
Oh.
Yeah.
That's what we all want.
A straight increase to awesomeness. The other kind of visualization is Brugerman Stretch. So that's where you stand up, face away from your computer, put your hands at your side, open up your palms, thumbs outwards, and take a deep breath. And you want to visualize a string attached to your chest and pulling up at a 45-degree angle. That's right. Good job. Kim is doing it perfectly. So,
and then it helps if you go,
you sing a little bit.
Yeah.
But what you're doing is you're opening up your chest and taking a deeper breath while you do that. So more oxygen is always better for you. A couple of the things that you can do for your lower back are pelvic tilts, or just rocking your hips.
Those are great.
rocking your hips backwards and forward as you have a tall posture.
We advise that for people driving a lot in the holiday season like it is now. A lot of people are taking longer trips, so pelvic tilts are great for that as well.
Yeah, the slower you go with the pelvic tilt, the better, and you shouldn't try to force too far forward or too far backwards in your pelvis. And the best way to visualize that is just put your hands on your hips, and you can feel your hips forward and feel your hips backwards.
And think about creating a bigger curve in your low back, like arching that low back as you're seated.
Yeah, if you're having a hard time visualizing that, you can lay on your back and do it. And that's the way to do that is you're just pushing your back into the table or into the ground, and then you're pulling your back away from the table or the ground. Another great easy exercise is to stand up, walk away from your computer, and keep walking. Getting motion in your low back, creating a sense of separation from your computer and yourself is really important because it allows you to de-stress for a little bit. So getting up, walking around for a couple minutes, getting a good attitude, sitting back down, getting back to work. Though that's a really, really key point of staying happy. Now, most people that work from home are very, very happy. If we could work from home, I'm sure we all would.
Kim's thinking about it right now. She's longing.
Oh, is that true, Kim?
In her eyes.
Kim, you want to work from home?
Sometimes.
Oh my gosh.
I miss my dog.
I thought he was going to come and hang out with us.
He's a lot. He's just
Too much?
Yeah.
He's stressed out?
Yeah, he gets stressed. I get stressed. It's just a lot.
Perfect.
I do have a question. Would trying to just touch your toes help with like low back while you're
seated or while you're standing?
Oh, I don't know. Either.
Any kind of warming up, any kind of exercise is good as long as you don't have any other injury that you're worried about. Like if you have low back pain and you have numbness and tingling going down your leg, I wouldn't advise doing toe touches. But just getting up off your duff and walking around, getting the pressure off your butt.
And if you feel like doing some toe touches or some lunges or some squats on the wall or something, that'd be totally fine. But just basically, as long as you just get up and move. And
kind of reset all that down there.
Right.
Yeah.
And sitting, it just puts so much compression on the low back. And if you're not sitting properly, that puts even more compression.
That's right.
And it overstretches certain muscles for too long of a period. So you just got to get up and move.
Yeah, when you sit down, you're sitting on what we call the ischial tuberosities. And those are your butt bones. Well, attached to your butt bones are what? Your hamstrings. And down throughout your leg, the hamstrings are attached to the bottom portion of the knee and through the ankle. So when we sit for long periods of time, or if we don't get up, we are chronically shortening those muscles. So people that have low back pain are notoriously linked to have seated desks.
Yeah. And we have those hip flexors too, which you don't think about them being contracted, but while you're sitting, they are. And then they not only flex your hip, but they also, a few of those muscles attach to your lumbar. So that can also cause pain.
Yeah, so the other day, a patient was on the table, and I was working on them. And as they were laying on the table, I was adjusting L1 and L2 and L3 and just working through and putting proper motion back into those discs. When I was doing that, they stated, I can really feel that stretch into my right shoulder. And they're like, why is that? So I was explaining to them that you actually have muscles that run from your butt to the top portion of your upper back, the entire way, and into your shoulder blade on both sides. Now that's kind of a visualization for people, but like everything is connected. Everything that we do here has an effect on other things in your body.
And that's the reason we don't just focus on one spot, because we got to look at the whole body in general and figure out what the source of that issue is.
Yeah, that's why we take our time and do the diagnosis and the consultation before we agree to accept you as a patient, is to make sure that you're at the right place.
So patients that come in here that are working from home, do you guys do like traction with them and then the wobble chair?
Okay, so someone that's working from home, we will start with adjustments of the neck and upper thoracic. We look at the musculature and make sure that their shoulders aren't up past their head. And then we start with cervical traction, phase 1. And then once we get to that and into maintenance, some people graduate early, but then we go to cervical traction phase 2.
And the kind of traction we're talking about, some of you may be visualizing like us pulling up on someone's head, traction that way. That's not the one, the type we're talking about. We're talking about a traction that's meant to induce
It has an air
a
bubble.
curve into your neck, that proper lordosis.
You basically lay down on this.
Yeah, you lay down on your back, and we'll just call it a bubble.
Yeah.
It goes under your neck, helps promote that proper curve or lordosis in your neck. And then wobble chair as well. Anybody who we can get into those therapies, especially if they're working from home, we would want to eventually get them.
Or just even people working at a computer, I guess, right?
Yeah. Yeah, we're focusing on people that are working at home just because
it's new.
Yeah,
it seems to be that seems to be one of the sources, at least, of the issues we've seen.
And then we talk about exercise with shoulder retraction, and then band work, a TheraBand work.
It's just a band work.
Where if you're a lot of the muscles in our body get tight in the front part, right? We talk about the pecs, we talk about the flexors that get tight more often than not, and the extensors are the ones that get left behind. The rhomboids and a couple of other muscles in the upper back.
We have some patients, and we'll put our hands in between their shoulder blades, and we tell them to try to bring those shoulder blades together. And some people they try everything they can.
Am I doing it?
They cannot do it. They just don't have that musculature built up. So that's something we have to work. That's what we give those bands
I see
for.
a lot of that with like new exams, like new patient exams. Dr. Josh will ask them to do that, and they just can't. They don't know how to use those muscles to do that.
Yeah. The key word for that is the activation of the upper back muscles. So TheraBand work with those, and then proper posture. So there are 3 curves in your spine that you should have well maintained: the neck curve, the upper back curve, and the low back curve, or cervical, thoracic, and lumbar curves. And so maintaining those curves will help your posture and reduce the chance of subluxation in your spine.
So with a lot of this stuff, it's easier when you're visualizing it. So like we mentioned earlier, if you have questions about this,
if you have any questions, please email us at kim@mfwellness.org. And for myself, Dr. Brad, Kim, Dr. Josh, have a good one.
Where is Dr. Josh?
He never showed up. One thing, we only have one more podcast before the season ends.
Oh my gosh. What are you going to get me for the last podcast?
Kim.
Kim?
Are you going to get me something?
Are you my secret Santa?
Maybe. You'll never know. You won't know until the 22nd.
That's because she's not going to put any extra work in, is what she's saying.
We just drew secret Santas, and so...
Yeah. It's gonna be a hullabaloo.
There's not a buzz around the office.
It's gonna be a hullabaloo. So, see you guys soon.
And a big thank you goes out to Hug Monster Sound for somehow allowing the doctors' voices to sound even better than they already do.